there's going to be some massive changes in Medicare Advantage that are going to affect a lot of people with their Medicare coverage. And it's something we need to kind of be aware of as we're going through these next couple of years, because things are changing. And what's primarily changing is reimbursement amounts to Medicare Advantage plans, also utilization. It's taking a real toll on the private insurance carriers that offer these Medicare Advantage plans. If you understand Medicare Advantage, it is not original Medicare. It is a separate part that takes you off of original Medicare and puts you in the plan of a private insurance carrier. And these private insurance carriers are shocking for-profit private insurance carriers. So their bottom line is super important. And there are some major changes coming to these Medicare Advantage plans. I'm going to go through some of the issues right now. I just wanted to jump in for a quick second and invite you to join my private Facebook group, Talking Medicare, where you can get answers to just about any questions on Medicare and interactions with others that are also in Medicare. There are no agents, no sales whatsoever. It's absolutely free. Just visit talkingmedicaregroup.com. It'll take you right there. You can sign up for free. Easy to do. Enjoy the video. And something we need to understand is it just came out recently that Medicare and Social Security are due to be insolvent in 10 years. And that's actually a little bit longer of a timeline than they had said previously, but within the next 10 years. And to get right up on that insolvency point is not where it's going to go. Things need to change one way or another. Either costs need to come down, funding needs to go up, taxes need to go up, whatever it may be, to save Medicare and Social Security as a whole. But that's different than what's going on with Medicare Advantage. And Medicare Advantage has been around for a long time now, and it's taken a pretty big chunk of the Medicare market. About a little more than half the people in Medicare are on Medicare Advantage. And Medicare Advantage plans are the ones that you see on TV all the time, really selling you into their Medicare Advantage plan. And there are many different reasons why I would never choose to go into a Medicare Advantage plan. I really don't understand how somebody does choose to leave original Medicare, because original Medicare is fantastic. It really does exactly what it's supposed to do, and there's very little, if any, customer dissatisfaction, where it's a completely different story with Medicare Advantage, because, again, you're going into a for-profit scenario where dollars are important and your care depends on how much profit a company makes. And that's just not where I would want to have my health insurance going forward. But what's happening right now is utilization is picking up for whatever reason. Since the pandemic, people are seeking services more, and these Medicare Advantage companies have been very competitive against each other in vying for the money that they get from Medicare. So let's understand that for a minute. Medicare actually pays a Medicare Advantage company more than what it would cost to keep somebody on original Medicare. So that makes absolutely zero sense right there. They brought in these Medicare Advantage companies really to lower costs and to contain the spending that Medicare has to spend for health care. And Medicare Advantage companies now cost more than what it costs to stay on original Medicare, and the satisfaction rate is much lower on Medicare Advantage than it is with original Medicare. So makes no sense there whatsoever. Hopefully Congress is going to figure this all out pretty soon too, where the idea, if we're going to have Medicare Advantage, if we're going to let private insurance companies run some of this show, then it ought to save money. And that's the whole point, is to set restrictions on people with their doctors and their hospitals and their networks and referrals and pre-author, all that stuff. It should at least save money for Medicare, but right now it does not. It actually costs more. But what's happening right now is they have announced rates going forward into Medicare Advantage, and they did not go up as much as Medicare Advantage was expecting. So the reimbursement rates are not what Medicare Advantage was looking for. And you now have articles like this coming out, and there's many of these articles. Health insurer stocks slide as final Medicare Advantage rates disappoint. Or millions of Americans get their Medicare Advantage benefits cut. CVS Health grows more cautious about 2024 as it deals with rising Medicare Advantage costs. Medicare Advantage enrollment drops in 7 states. And last one is CVS shares plummet on health company slashes profit outlook on higher medical costs. So this is where you get the biggest indicator on what's going to come down the line on Medicare Advantage, because again, these are public companies. They have to answer to their shareholders. They have to make adjustments in benefits, in services, in order to be able to create more profit. So what we had in April from a stock standpoint is kind of jarring, and it looks like this. CVS stock was down more than 8%. United Healthcare was down more than 7%. Elevance was down more than 3%. Centene down more than 6%. And Humana down more than 10%. Humana and United Healthcare are by far the largest Medicare Advantage companies in the country, and their stocks have tanked basically over the last month. So it's very telling on what's going to come from these companies. They have to do something. So they're going to adjust how they do business. They're going to be leaving certain areas, which, again, if you're in that Medicare Advantage plan, all of a sudden they leave, then that's a major disruption in your health care. There are certain scenarios that really paint a really dark picture on what's coming with Medicare Advantage. And I'm going to link all these articles in the description below. If you want to read them, feel free to read them. Here's a few quotes out of some of these articles. In the Newsweek article, you have Humana CEO Bruce Broussard, who says, "We acknowledge that the industry is experiencing a dynamic and challenging time that we must navigate." That's corporate CEO speak for, holy cow, we got to do something in order to save our bottom line. And again, it's a big deal. Humana CFO Susan Diamond says, "We are anticipating that membership declines in 2025, largely because we intend to exit certain plans in counties." So they're going to be pulling back plans that they have membership in. So their membership is slated to decline in 2025. UHC CEO Andrew Whitty, "Our strategy continues to focus on improving as much stability as possible in these reduced funding environment." So these are things you have not heard from Medicare Advantage in quite a while, where they're actually scared. They're worried about how things are going to go in the future. It's hard to predict exactly if you have lower funding and higher utilization at the same time. It's a significant issue for Medicare Advantage. So where we need to be cautious is how we understand our plans. And the last thing we want to do is get caught in the middle of this type of situation. So Medicare Advantage, again, in the past has been very competitive with each other, and they start throwing out all these additional benefits that they put in a sales model to entice people to join. Things like over-the-counter medication reimbursement, some Part B money give back if you fit into a income category, some rebates that come along with what they do. And what it does, it gets people to join their plan not based on the health care that they're going to receive, but maybe on a Visa prepaid card that they're going to receive, but that offers very little benefit compared to what the health insurance part of the plan would actually offer. So that's a major problem, and why the government has allowed this to go on and let them really put up smoke mirrors to get you into a plan that's going to provide much less benefit from a health standpoint, but maybe give you a little extra benefit on the side, is kind of crazy. So hopefully that's going to change as well. They just put restrictions this year on all those silly TV commercials with all the celebrities and the sports athletes that promise all these things, but really are only offered in a very small percentage of people that qualify for them, but they make it sound like everybody's going to get it, and it's just not the case. So back to the choice that you have. Again, I don't understand why people choose to leave original Medicare. If you have a case to make, you can make it down in the comments. Maybe you can convince me otherwise, but I really just don't think so. Original Medicare is autonomous. If you have original Medicare and a Medicare supplement plan, it's exactly the way you would want your healthcare to run, where there's very little out of pocket during the year from medical expenses, and you can do what you need to do. You don't have to go through any referral process or jump through hoops or make sure you sign the correct forms or get pre-authorization. Original Medicare, if a doctor says you need it and you agree and it's medically necessary, it's approved with Medicare. And if Medicare approves it, the Medicare supplement plan has to approve it. A lot of people don't understand with a Medicare supplement plan, even though they're generally run by some of these same for-profit Medicare Advantage companies, they play zero part in the decision of your health when you're on Original Medicare. There's no interaction between you and the insurance company. There's no interaction between the doctor and the insurance company. It all runs straight through Medicare. If Medicare approves it, then it's covered. The supplement has to cover it. The doctor submits the claim to Medicare. Medicare pays. They collect from the Medicare supplement company. So it really doesn't matter. It could be Acme Medicare supplement company, and it functions really without any interruptions whatsoever. So again, that's the number one reason I would always want Original Medicare, because my health care is going to go the way that I want it to go. And with a Medicare Advantage plan, it's just completely different. There are a massive amount of complaints. There's pre-authorizations. There's denials right off the bat. They just had a congressional hearing on the fact that many Medicare Advantage companies are just auto-denying when a request comes in from a doctor to a patient, that they just auto-deny it. And then you have to fight to get it approved. That is not the way you're going to want to have your healthcare run. If you need an MRI for something that you think is pretty doggone serious, and your Medicare Advantage company says no, and then you have to file a grievance and appeal and go through weeks or months of time before it's just absolutely ridiculous. With Medicare, your doctor says you need an MRI, you agree with that, it's done. You call, you make an appointment, you go have it, and then your doctor has the information that he needs or she needs to get whatever you need done in a timely fashion. And that's exactly what we want with our health insurance. So take a look at these articles. Just be aware changes are coming, and it's kind of past time. It's certainly about time that these changes come, and hopefully they will put them on a level playing field. You know, the Medicare original world with Medicare supplements, they went out of their way to make it so that the plans are standardized. A plan G is a G, and N is an N. You know exactly what you have. Why in the world they don't do that with Medicare Advantage, where they mandate what these companies have to offer and the way they have to offer it, is just beyond me. But they don't, and that's what makes Medicare Advantage so convoluted, and you can't figure out which one is the best when you're going to try and pick your plan. It's really crazy. And then you go based on where your doctors are, and then next month your doctors are no longer there. It just makes a very difficult road to go down when you're certainly getting older and you're going to need your health care more. So I hope you found this helpful. Make sure to download my book. You'll find that very helpful. We're here to help with any of it. Give us a call or visit my website. Got a lot of information. Have a fantastic day. Thank you for taking the time to watch my video. I hope it'll make things a little bit easier as you're trying to figure out all your Medicare pieces. Now, if you're going to stay with Original Medicare Part A and Part B and a Medicare supplement plan, G or N or GHD, whatever it may be, we can help with that. So that's exactly what we do, is we find the best Medicare supplement plan in your zip code. So if you go onto my website, MedicareOnVideo.com, put in your basic information, we will email you a quote with the best value in your zip code. Makes it very easy to do. You'll see right on my site below the box, we do not share or sell your information with anyone. But do be careful if you're filling out other websites. That's exactly what most of them do, is they take your information and they sell it to multiple agents, and you're bombarded with phone calls. So we don't want any of that. We want to make it as simple and easy as possible. We have access pretty much to any carrier in all 50 states, so we can make it as easy as possible. If you want to get a little more comfortable, just Google Medicare on Video and look through my Google reviews. We just have a tremendous amount of very happy people that found it simple and easy to do and get the right plan that they're looking for. So it's in your best interest, and I get no customer service phone calls. So people are happy, I'm happy, It's a terrific way to do business. I certainly hope you'll allow us to help you. If you need anything at all, feel free to utilize my information on my website, my book you can download, and we'll do everything we can to make sure we get all your pieces in the right places. Have a fantastic day.